Good, thanks, Keith. Now, what advice would you give to a trainer for the best way to carry out an MCR assessment?
Again, great question, Tim. I think the important thing is to understand how it's split up into the generic professional capabilities, the CIPs, capabilities in practice, and how it all comes together. I think it's really important to know what stage of training the trainee is in. So the trainees, the expectations, so the GPCs are assessed as being appropriate for phase. So you need to know where the trainee is. So if you're assessing a core trainee, you should be assessing them as appropriate for phase if they are. They shouldn't be getting descriptors for development from the consultant because they think it should be that they're ready to be a day one consultant, which they won't be. And so I know that has been something that has been raised. The core trainee is concerned that they're being shown as requiring development because they're not at consultant level. Whereas actually for the GPCs, if they're appropriate for phase, they're doing the right things as they would do, it should be at levels 1 and 2 of training, then there shouldn't be any descriptors to utilise. And so trainees at any level can be appropriate for phase, or they may have some points for development. And if they do have points for development within the GPCs, that's where you would utilise the descriptors. If you feel that the trainee is appropriate for phase, but you want to help them develop to the next phase of training, then you can use free text and write free text in the box. Don't use the descriptors, list them as appropriate for phase, but outline briefly in a sentence in free text how the trainee may cover that aspect, that GPC, to develop to the next stage of training. So very much utilise that combination. I would use the descriptors where development is required. If development isn't required, but you do think there's some advice how to go on to be appropriate in the next phase, then use free text. If the trainees are doing really well in a area and you want to reflect that, again, use free text, or a little cheek if you think, well, one of the descriptors does cover that, is that you could cut and paste the descriptor. You don't actually have to click on the descriptor, and that way you can use the wording if it's appropriate, but it doesn't come up as them requiring development. So that's in relation to the GPCs, and I think it is important to have considered those. If you're just a clinical supervisor, I'm not saying just, but if you are a clinical supervisor and you're doing the GPCs, GPC 6 to 9, just remember to consider the trainee clinically as you see them, because the educational supervisor can add in the additional information or referenced supporting information that the trainee may have put into their portfolio related to teaching or research per se. For the CIPs, when you're undertaking MCR, again, it's really important for the trainer to know the trainee's level and the phase. That is shown well in the charts on the curriculum, so that you'll know the level to which you're assessing. So what you don't want to do is have a trainee that's in phase 2 and you think, well, they're all right, they're great at that, and list them off, and all of a sudden find that the trainees turn around and say, well, that says that I'm appropriate to finish the phase of training. Clearly there would need to be some points of development, and as well, it's important that trainees understand the level that they're getting assessed to, and that will be a part of the reason for comparing that to self-assessment. So it's really important to know the trainee's level and phase, so that you get the appropriate representative supervision level. When you're using the supervision levels, if you put anything less than a level 4, so for most of the trainees in phase 2 certainly, and for a lot of phase 3, there will need to be the use of descriptors or free text that show, but mainly the descriptors, to show how the trainee would develop. Now, some things they'll be doing really well, and you can show that. So I would suggest using 5 of the descriptors, some of the that shows what they do well, some things, the points they'll need to develop. So early in phase 2, if there's something that they're doing well, then use the descriptor, but use the other 4 to show how they need to develop towards being a level 4. At the end of phase 2, you may find that there are 2 or 3 things that they're doing really well, but a couple of things that are points for development. And again, as the level 7, the first part of phase 3, there may be 4 things that are doing really well and just 1 point really to concentrate on to development. For say for CIP4, the in theatre operating aspect, that may be some technical skills. And remember that you're using those descriptors and giving them some defined development for the next 3 to 6 months for that phase of the MCR. To make it easier to start with the MCR, we said this at the start, and I still think this now, it's really important that everyone writes down a pen portrait. How do they see the trainee? And that starts the discussion between the at least 2 clinical supervisors that are there in the room. Ideally, you know, it's best if it's 4, and then you can agree the points made and the descriptors used, and that what you should remember is that the points that you're raising to the trainee are essentially the start points to the feedback discussions. And so there should be some developmental ideas, but some of those are how we're going to do that may come from the feedback discussion. Again, that's a really important part of the MCR in that it enables trainee development. That's what the MCR is. It's part of trainee development. So it should be undertaken by at least 2 supervisors. And the more there are, the better it is. And the sort of greater protection of the consultant opinion comes with the more people that are there, because you can then give, I think, the more people, they're more in-depth developmental feedback. Sometimes it could be slightly challenging. That meeting should be face-to-face. Late contributors, those people that can't attend, should be sought from the named supervisors. That's within a 48-hour period, which very shortly is going to be from 48 hours working days and not include a weekend. And it's important that those people come back in and give some defined points. That allows the MCR to be signed off by the AES. And the AES should, to give a good MCR, be making some active comments, referencing the portfolio and able to show what ISCP activity has been undertaken. That AES noting is the point whereby we can, that's us at the ICP, reopen an MCR to, if there's a question, pushback, feeling it doesn't describe a trainee appropriately, trainee upset about some of the comments made, or the program director per se, or the ASN says on reflection, I want to add something else. We at the ICP can reopen the MCR to that stage, and then we can mediate with comments, or any disagreement could be mediated at that point. But further to that, we're not reopening and we're not getting rid of any MCRs. The other thing that's really important to say from a trainer point of view is to recognise the learning assessment, the learning agreement, and how the ASs can use the learning agreements to set the objectives from the MCR. They'll look at the self-assessment and the MCR together, set the learning objectives, and therefore it is, and we'll keep coming back to this, a really good way for trainees to highlight something they want to talk about and get to be part of their development by putting it in their self-assessment. So it's part of the discussion with their AS, and then that becomes part of their discussion with their learning agreement. And then the next MCR, it'll be something that's assessed.